So one of the most common things we hear of as pelvic floor physios is how much people feel kind of low back pain and hip pain during the pregnancy, just that ache that comes on throughout the day. And the hip pain, one of the things we hear a lot of is how you have to keep tossing and turning at nighttime, that you might be able to sleep on your side for a little bit, but then it gets achy and sore and you have to do all the work of trying to flip over in the bed. So here are some ideas to help with the low back pain and the hip pain that can be so common with pregnancy. Now, one of the things we love the most as pelvic floor physios is being able to roll out these tight muscles. So during pregnancy, our backs arch to make room for the baby, and that's wonderful. But the problem is that means our glutes have to do a lot of extra work to help hold up the weight of the baby. So our core muscles are stretching out, and now we have to use our glutes. Now the problem is that's wonderful, but those glutes are big muscles. They're maybe not meant to be on all the time. They're meant to be like our powerhouse muscles. So when they're pregnant, man, they're working overtime. So what we want to do is give them a little bit of a break by helping decrease the tension and the tightness that are in our glutes. It really saves us from a lot of low back pain. So we love using foam rollers. Now, foam rollers get a little bit awkward later on in the pregnancy. A lot of women find they can do this up until about week 30 of the pregnancy. But what you want to do is you want to sit on the roller. So you just the hardest part is just getting down when you're pregnant. But once you have a seat, what you'll do is just practice sitting on one glute. So just sitting on one bum cheek. And you want to roll all the way from the top of the glute down to the bum bone. Now be careful that you don't go over top of the bum bone. Just go to the bum bone. And you're starting kind of right in the middle of the glute and you're working your way over. Be creative, try different angles, different directions. You're gonna feel some areas here that are really tight. Now, in terms of how much this should hurt at first, what we wanna do is maybe go to a 5 or a 6 out of 10 for pain. So if 0 is no pain and 10 is the worst pain imaginable, you wanna stay at around a 5 or a 6 or so. And usually we wanna do this kind of every day. And the first couple of days that you do this, you might actually notice that the pain gets a little bit more tender, it gets a little bit worse for 2 or 3 days before it turns a corner. So during that time, just make sure, again, you're being gentle with yourself. Again, that 5 or 6 out of 10 is a good landmark. And I promise, after about 2 or 3 days, you turn a corner and it doesn't hurt so much. And you're actually gonna be like, it's like a good pain. It's like a deep massage in all those muscles. And this can be your best friend when you're pregnant. A lot of times we recommend doing this rolling right before bed, again, to help with that hip pain, that back pain that can come at night where you have to keep tossing and turning. So again, try and cover a lot of the muscle. Try different angles, different directions. And when you get to a tight spot, you can roll it out for a couple minutes. And if it's still really tight, well, just stay on it and stay perfectly still. And stay and stay and stay. And what you'll notice is what was a 6 out of 10 for pain is melting away. Now it's a 4, now it's a 2, now it's kind of like a nummy pressure feeling. But that tightness, that tension is just melting away, so that trigger point is disappearing. And you can roll for a couple minutes. Usually we say about 2 to 5 minutes is a good place to start, but you can do increments throughout the day. You could do a minute here, you can do a minute there. But again, doing it before bedtime will usually buy you some relief. Now, sometimes this is too awkward. Either the weight of the baby feels too much or it hurts our arms and our shoulders. Some tips for that is, again, make your feet do the work for you. Don't get stuck kind of being on your arm too much. That'll hurt your arm, that'll hurt your wrist. So again, prop up, be sitting on the roller. Try not to get in the spot where you're like laying really down on it. So use your feet to do most of the work. Try not to get stuck kind of weight bearing too much on your hand. Now, if foam rolling isn't for you, if it's uncomfortable, if you feel like it's a little bit too much, what we can do is do it with a racket ball. So we like using racket balls or lacrosse balls. This is a lacrosse ball that we're going to be using today. Tennis balls are okay, but sometimes they're a little too soft or they slide a little bit on the wall. So see if you can kind of find yourself a lacrosse ball. And what you'll want to do is all the same thing, but now you're using the ball against the wall. So you're going to be standing up and you're going to take the ball and you're going to put it all over your glute muscle. So you're going to keep your back to the wall and you're going to massage out. So use that ball against the wall and massage out. Now the ball can be a little bit more targeted. You'll find those tight spots. You'll be like, oh yeah, I feel that. And again, only go to about a 5 or a 6 out of 10 for pain. So if you're pressing too hard, it's pretty easy to get to a 7 or an 8. Don't push that hard. Only go for a gentle massage, 5 or 6 for discomfort. Now there's 2 hot spots that we love to hit when you're pregnant. We love doing this top glute line. That's a great spot. You're going to find good ones there. And then we love that deep gluteal. So that's the deep part of the hip capsule. And again, all these muscles are working overtime when we're pregnant. They're there helping to hold up the baby. But again, sometimes they're just a little overworked. So giving them a little bit of a break, helping them get rid of this tension and tightness can be amazing in terms of the relief you can get. So again, about 2 to 5 minutes per side, or you could do a minute here, a minute there. Only go to about a 5 or a 6 out of 10. And focus on the areas that you feel the tightness and compare side to side. You might feel like you have a little bit more tightness on the left side than you do on the right side. So it's great to be able to compare. And when you get to one of those good spots, you're like, okie doodle, there it is right there. You could stay perfectly still on it for a little bit, do a trigger point release. That's when you go to, again, only about a 5 or a 6 out of 10. Stay perfectly still and be patient. It could take 20 seconds, 30 seconds of just sustaining the pressure on the wall, but you will feel it start to let go. It's just gonna kind of melt away. And right now the muscle fibers aren't getting any oxygen when I'm kind of pressing on it. And when they're oxygen deprived, they kind of have to melt away. They have to let go. And that's that ischemic response. You might have gone for a massage treatment where they just hold a trigger point for a little bit and then you can feel it melt away. You're doing the same thing with a ball. So you're being kind of your own massage therapist back here. Again, foam rollers, balls can be really, really useful. Keep up with them every day if you can. Again, the first 2 or 3 days can get a little bit achy in there, but it turns a corner, it gets way better, and you're gonna be like, oh, I can't wait till I can roll with a ball.